usually the label is on the side of the transparent dressing, but I think that this packaging is totally separate. When you open this with clean gloved hands, it literally tells you where to open it at. You open it flat and you treat it as if it is sterile, because it actually is. So kind of like how you open your sterile kits. Because you want to try to keep all of your contents clean as possible. Because if you're doing this on the patient's bedside and you didn't clean that table beforehand, you didn't put a pad or anything down, it's contaminated. So I don't want to be putting everything on that patient's contaminated table. For your other packages, this would not come individually wrapped. So you need to go ahead and open this too. You want to pull it out and put it on the table? No, we're just going to keep it in this packaging. So I had you do all that to get your tourniquet. Once you have your tourniquet, we usually go about 2 inches above the insertion site. And so it looks like for all of our students, our patients, we only have a hand. That's all we have. So you're going to go about 2 inches above. I keep calling on her. Can I ask you to stand, please? And so we're going to cross, and then we're going to tuck up. If you have fingernails on, this is going to be hard. So about 2 inches above your insertion site. We don't want to put a tourniquet on a joint, so that's why I didn't put it right there on her wrist. And whenever you put your tourniquet on, it should be easy for you just to pull one string to release. So I'm going to cross, and then do what, everybody? Tuck what direction? Up. And that should allow the veins to start engorging. Look at her bifurcations.
Just look at them.
So you see those bifurcations? So that means that you're probably not going to choose any of these veins. That one right there, okay? What size needle?
18. No, I'm sorry, 22. 22, sorry.
Yeah, 22.
22, yeah.
So 21, that way your fluids flow effectively. 22 is if they're like really fragile and really small. Thank you so much. And so you all are going to start off with putting the tourniquet on your partner. Once you all, and so it's not, once you put a tourniquet, everyone has hand sanitizer. Let's give you, go ahead and use some sanitizer. You have an order for fluids. You have to start an IV. You're going to select your distal site and then the gauge based off the reason for the IV. So for ours, it's just maintenance fluids. We're going to use a 21, a 20 gauge. We're not going to use the 18 gauge in someone's hand. Before you put on your gloves, if the patient's not on isolation, before you put on your gloves, go ahead and start doing your vein selection. Because once you put on your gloves, it may be hard to feel, okay? So I have marked your mannequins. So if you can't find a vein that gives blood, it's because, so go ahead, really pretend, pump, go ahead and bounce, and sometimes you may have to go over. And so sometimes you really can't feel.
Nice.
It may not give blood though. This one right here gives blood, so go across it and then you can go up it. The reason why you have to follow the vein, why do you need to follow the vein?
So you don't cause infiltration?
Yeah, you're gonna see through.
Yeah.
So you don't poke through, so you don't cause the infiltration. So it's just not like, oh, that's the vein. Because if you don't trace it, my vein curves.
Especially on the hand.
Okay. So everybody knows where they're going? All right, so who's going first? Raise your hand. Nala? Okay.
These are our 18 gauges.
Yes, because of my mannequins, they give awesome blood flow.
Okay.
And so what I ask all my students is that when you're in a position of leadership and your facility has expired supplies, remember me, because I be buying all this stuff, and so y'all got 18 gauges today. All right, and so now go ahead and glove up. Who's ever going first, glove up. And if you need to move your items down, or if you need to move her. So for the person who is going to be performing venipuncture IV therapy first, I need you to be comfortable. You move that hand, you move your supplies, you can stand up, you can move your partner.
You comfy?
Go, 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 go.
And
Look
so
for
as a
backlash.
CNA,
Yes, girl,
then
yes.
you have to be a
No,
CNA
you don't push that
in
needle
order
more.
to
The green
work
The
in
green.
the emergency room as a
So
CNA.
release his
Like,
hand.
but that gives you the
Release his
ability
hand,
to
push
draw
that green
blood
part.
and things like that.
Push the green part.
Because you
It's
get
only
like
hard
four
because it's on a
seals,
mannequin.
You know,
Where's your,
and then you do
Okay,
cath
remove
lab
your
stuff
tourniquet,
when I
remove your
became a
tourniquet.
nurse.
yep, and then
I
get
always
your
try to
4x4.
Yep,
The big
and
one.
put it under.
Pause.
Yeah.
The
If
big
you're gonna
one.
put an IV in, there's no need for me to stick them
Because
twice.
when you take out
So when
the,
I became a
it's,
nurse,
he's
And
gonna
so be
believe.
careful, because what happened last time with your partner,
and now
when
I
she
just
was
rub
kind of
my
moving
men's
slow,
arms all
I
the
need
time,
this
and I'm
closer.
like,
Your
Lord,
extension tubing should always be right next to their
around
hand.
the
Move your extension tubing next to their
Yeah, my
hand.
husband got rolled. I
So
saw
keep
him
it in its
roll back.
package,
Yeah.
Beautiful.
but
Yeah,
put it
this
next
is
to their
real
hand,
thick.
okay? Because
It's
whenever
like stopping
now,
my
you're
arm.
gonna
I know what you're
occlude
thinking.
without touching the insertion site. So apply pressure, not with your thumb, using your thumb too
Yeah,
much.
the biggest baby.
2 fingers, move that needle fast and put it in the sharps. Move it fast, put it in the sharps.
We've got
Connect your extension tubing.
And the way I
Good
react,
job, good job, good job.
Yeah.
You gotta hold this now, 2 fingers on this part right here. Don't touch the insertion site. So these 2 fingers here, hold here with those 2 fingers,
My husband's
anchor there.
6'4".
Oh, see, it's all.
Pull back first.
It's so
Just a little bit. Good. Okay, now flush.
It's there.
Yeah.
Just a
Flush